Hello and welcome to my presentation. My name is Eric Harper. This is for Integrated Mobile Healthcare, EMS 4308, and we're going to be talking about community paramedicine. Community paramedicine. What is a community paramedic? Well, a community paramedic is basically a program to where healthcare providers that are in the pre-hospital field, your paramedic EMTs, firefighter paramedics, to where they will actually go out to the residents. It could be anything from making sure that it's a well-being check, getting vital signs, doing assessments, uh, pretty much anything that is not emergent, not a full-on 911 response. Uh, who do they service? They service the community, everybody, whether they are in a home, a trailer, travel trailer, RV, whether they're homeless, does not matter. This is for everyone. Uh, the main demographic that's seen out there is your older residents. These are the folks that they're pretty isolated, maybe no family, and they need that extra help. What are the pros for this type of project? Well, health promotion, just trying to um, make things better for everybody. Getting someone the help that they need. Maybe that's we're not looking to take them to the emergency room. Maybe they need help. Where can they get to a shelter? Uh, where can they go for food? It's right down to that basic. Reduced healthcare costs, less 911 responses, less transports to the hospital, and less medical bills by being in the ER and for care beyond that. Early detection and intervention. The example I like to use is specifically, say, for an elderly couple. Uh, Community paramedic would go there, do an assessment, take some vital signs, be able to see what's going on, and see maybe what they need is not an ER visit. Maybe help them out in some other way. And then health equity. Health equity, it's going to be for everyone. Whether you're homeless or whether you have a home, uh, any of that, everyone deserves better health care. The Ontario study. The Ontario study is something that I came across to where a very large range of agencies and individuals were all brought together, and they took a look at community paramedicine and how it works. And this one quote stuck out to me. Community paramedicine is fitting with primary care, social services, and pre-hospital care. One study envisions systemic integration becoming part of the primary care pathway. Well, what's that mean? That means that this can be part of the overall solution. This can be just as important as a doctor visit. This can be part of somebody's overall care. Support from internal stakeholders. How do we get this off the ground? Well, you're going to have support from medical directors first, senior agency staff, and then field staff. Uh, you're going to have buy-in from the people that are going to do the work. You will have much better success if you have that. External stakeholders. This is where it could be to where your legwork and your data collection comes into play. Getting support from your local hospitals, getting support from your city council or county commissioners, because they are going to be looking at what are you doing, and they're going to be looking at funding and is it worth it. Other emergency services, because depending on how well you do, they could actually become involved in different ways, such as like a non-emergency service, that type of thing. What are the cons? Let's take a look. What are going to be the tough points? Funding and reimbursement. Right now, it's going to be very, very hard to get reimbursement. Medicare, Medicaid. It's going to be real tough trying to get funding from that. Integration with existing healthcare systems. Well, how are we going to be able to do work with agencies that may push back against it, specifically home health? We need to educate and show that that is not what we're doing. Sustainability. How are we going to keep this going year after year? And then geographic and demographic challenges. You're going to have agencies that are small. Can they do this? How are they going to do this? Do they have the funding? Do they have the staff? Do they have a vehicle? Compared to larger agencies that are going to be able to draw more from that, from their reserves, to get this type of program started. A risk assessment plan. That's going to be number one. Going to have to develop one. This is what you're going to be presenting. This is what you're going to be putting out to everyone, internal as well as external stakeholders. This is what you're going to be putting out to the public. First off, identify the problem. What are you trying to solve? Then comes planning. Well, who's going to receive this service? You're going to have your city demographics or your county demographics. Funding. What is your plan on funding this? Is it going to be from internal budget? Are you also going to be seeking grants, donations, that type of thing? Implementation. How are you going to get it started? I would recommend a pilot program. Start small. Short-term results. They're going to want to see what are your projected short-term results. Will you start to see change right away? And then your long-term results, say 6 months to a year. You're going to have that data. You're going to have some type of survey. All of this data is going to have to be brought back around, and that way you can show, is it working, and do you need to make any modifications? Models across the country. Much of the country has some type of integrated mobile health response. Different sizes, different amounts of units that are available, that type of thing. But take a look around at other cities. Cities and counties. The crisis in healthcare, you're going to want to put that on the table too. EMS and fire, you're going to have to show that they just are overwhelmed at times, and how can this help? Emergency departments used as primary care. If you can, you've got to get with your local hospitals and you've got to get that data. Non-payment. A lot of people right now, the economy is struggling. A lot of people without work, without insurance, and then you're going to have to look at what can we do to get Medicare and Medicaid on board. Where to begin? Start small. Start with a pilot program if you can. One paramedic in a QRV, that type of thing. keep to your vision and your goal. You have got to stick with it. You've got to give it time. You're going to have ups and downs. And then research other agencies that are doing this. Look for agencies that are in cities or counties about the same size. How are they doing it? Contact them. Remember, everything that lasts started small and it had its ups and downs. All right, any questions, comments? Just let me know, and thank you much.